Good afternoon, everybody. Welcome to our media update for Monday, June 8th. It's hard to believe that we're starting the second week of June already. I hope that everybody had a safe and healthy weekend and they found ways to enjoy being with friends and family in ways that were safe and creative and fun. We need to have that time with loved ones. A reminder that the heat of today and upcoming days and COVID-19 are both things to pay attention to in the summer, and we hope that people do that now and in the days ahead. Today I'm joined by Benny Anderson, who is the co-chair of the Communication and Promotion branch for the Chippewa Valley Economic Recovery Task Force. That's the task force that we've talked about a couple of times that is doing work with all of our business sectors to reopen in ways that are successful economically as well as successful given COVID-19. And Benny is one of the people that's been working hard on that task force, and he's going to share a little bit of an update today about that. Before Benny shares with us, I'll give the state update, our local COVID-19 update, as well as a couple of new things that have happened since last week. And then certainly after Benny shares with you, I'll be available afterwards to answer questions. So, status update. Our negative counts at the state level for COVID-19 testing are at 333,253, an increase of over 7,000 negative tests since Sunday. Our total of positive cases for COVID-19 by testing are at 21,038. So more than 21,000 people in Wisconsin have now been tested as positive for COVID-19, an increase of over 200 since Sunday. About 14% of those people have ever been hospitalized. 2,860 people have been hospitalized at any point in time for COVID-19 in the state. And we are at 646 people that are Wisconsin residents that have died of this disease. Our testing numbers at a state level and our positives have remained fairly stable as a overall count of cases. In Eau Claire, our data update, again, is on our website and on the state website. The Eau Claire website is covid19eauclaire.org. That site has, on the front page, some basic data elements, and you can click on a button that is for more data, and you can get more comprehensive data at our Eau Claire site as well as the state site. Negative tests for COVID-19, they continue to increase. We're at 5,900, a little over 5,900 for negative tests for COVID-19. Positive tests are at 124, an increase of 5 people since last week, Friday, when we last talked to you. We are now at 100 people recovered from COVID-19. So again, our case numbers continue to go up, now at 124, and that has been a fairly steady increase over the last number of weeks. Our split of cases by age group and by gender, by sex, has been about the same distribution over time, and all of that information is on our website as well. A couple of state updates for you. The Department of Health Services announced today that more households will now be eligible to get food through the Emergency Food Assistance Program. That program does now allow households with incomes below 300% of the federal poverty level to now receive a monthly share of locally grown grade A foods that include meat, vegetables, fruit, juice, and many more items. So please look at that. For one person, the combined household income is $38,000 a month, or annual income, and for 4 people, the annual income for this benefit is at $78,600. So again, it's a resource for people to have healthy and safe food, something that's important at any time, but certainly when we want people to be healthy, to be in the best spot possible if they do get infected with COVID-19, it's an important strategy as well. We have locally continued to look at our local data. Shared with you last week is that we have our criteria that we are looking at locally to make decisions as we move forward about our local public health order, as well as really our recommendations around how we move safely through this pandemic. That disease data as well as capacity data gets pulled every Tuesday morning. It's data that runs through Monday. We look at that weekly and post it on the website by Wednesday morning. That data was there last week for our last week's run, and we'll have that again on Wednesday of this week. We anticipate that that data will give us a clearer picture about what we do with the current order. So the current order is set to end officially at midnight on Thursday, and we are anticipating that that data will help us again navigate the next step forward in our path with COVID-19. We'll share more after we look at the data tomorrow and likely on Wednesday when we're together with the media, give an update on that. There is a reminder, though, that disease continues. We continue to have deaths, like I just reported, across the state, and the increase in cases does continue, including in Eau Claire. Those increased cases are complicated in this community, and it's important that we continue to remember that COVID-19 is something that does spread if we are not maintaining physical distance, and does spread if people don't stay home when they're sick. So we continue to really ask everybody to continue to pay attention to those basic public health measures. A number of weeks ago, Captain Brzezina from the Sheriff's Department joined us to give an update about the congregate setting of jails and COVID-19. We've gotten a couple questions from media related to what's happening in the jails, and I'll share a couple of quick updates with you today, but certainly can answer more questions. All of our congregate settings, so those settings where people live together, are places where we are paying attention to COVID-19 and making sure that we don't have rapid spread. We have a number of those locations in Eau Claire where we do have COVID-19, and you've heard me talk about those in previous media briefings. And the places where people live in the same setting are places where we can have disease transmission. We see that in a family, we see that in long-term care facilities, and certainly jails would be another setting where that can happen. Testing is part of what the jail does, and our recommendation right now in all of Eau Claire is to test anybody that's symptomatic, and the jail is doing that. As people come into the jail, they are testing individuals that have symptoms. They also are quarantining any new inmates to the jail, separate from the rest of the jail population, to assure that asymptomatic people are not in contact with those that are in the jail for longer-term periods of time. So that quarantine period, like we do for other situations, is 14 days, and then those people that have been booked into the jail join the regular jail population. That 14-day quarantine does help keep COVID-19 spreading in a jail situation, which we've seen in other parts of the state. The jail staff does have their own healthcare staff working with them to do the testing. Health department does all the follow-up, and we have had cases that have been identified because they were booked in the jail. They are not connected to jail spread, but they happen to come, like we have people across the community, into the jail, become symptomatic while they're during their quarantine time, and then we do the case follow-up with them like we would in every other setting. At this point in time, there's been no spread of COVID-19 within the jail setting. These are all community cases. So we have Benny Anderson with us today. He's going to share a bit more about what is happening related to promoting safer businesses during this COVID-19 time, and promoting businesses so that they can get up and running in our community in a way that's successful. So he'll be sharing a couple of talking points, and then I'll be back to answer questions.
Good afternoon. I'm Benny Anderson. I'm the communications co-chair of the Chippewa Valley COVID-19 Task Force. Our aim is to help businesses reopen safely when they are deemed able to do so. So really the how and not the when. And that scope covers not only the safe reopening, but also when we feel it's safe to do so through looking at scientific numbers and some customer-centered stuff, also start to promote out the businesses and our area for tourism as we try to do that appropriately and safely. The task force is composed of quite a few organizations and basically all scopes of the community. So we have, City of Eau Claire, City of Altoona, the county, we have the health department, the chamber, the organization I'm with, Visit Eau Claire, EDC, all kinds of different things, and then all of the individual business sector co-chairs who are forming their own teams to help their individual sectors find traction in reopening safely, and then also how to promote that out as we can do so, which we're not at that point quite yet, but hopefully getting closer. It's really kind of very exciting to see how that team is made up, because we've had our two main co-chairs come out of retirement, Mark Faunus and Greg Moore, to help lead that. And then we have representation on every subsector from the health department, who has done some amazing work in changing, how all of these businesses communicate with them to form a more collaborative effort. And then also the sectors themselves being made up of basically competitors who are not only working together very efficiently and very openly to help themselves, but to help all of the other members in their areas find the resources that they need, find staffing, find PPE, find whatever they need to do to get the mission going again, and doing so very, very well in a team fashion. The updates that we're hoping to provide to you today are basically just on some of what we've been doing. Right now, a lot of it is in the how. So we look at, helping businesses decipher the order as it means to their sector with the direct input from the health department, but more fielding the questions and making sure that they have access to those resources. When they come into problems that they have, such as finding PPE or finding staff has been a big one, marketing out, what's available to locals as far as food pickup or the different ways that businesses are reopening. That's really where we come in. Past that, we've done some also community-minded things, such as the restaurant PSA on how to use a restaurant in these new situations as a guest that's open to the public, minding your social distances, wearing masks, the PPE that you should be looking for, how to socially distance with, your family versus an individual versus people in the bar, and things like that. And we have a couple more of those planned for basically wearing masks, and the decal program, which has been another big initiative of there, which is where businesses can sign a pledge to not only promote and practice their safe habits and their social distancing as a business, but to keep their employees and their customers safe, and have the ability for customers to look at that as a business that is really open to the idea of keeping their clients and their family safe for it. Past that, we are also going to be moving into marketing eventually. We have a wide scope plan for that across all mediums. You're seeing some of that right now with the PSAs and with the Facebook work to promote out to businesses that these resources are available, and also that they can get their jobs posted. We have a lot of resources as far as resume writing for individuals who are now unemployed, and for interviewers who now have to do those interviews over virtual premises. And then on top of that, we will then start doing our normal marketing as it is deemed to be safe for local campaigns to keep people in our area local and using the businesses that are available. And then past that, when it's safe to do so, to start to advertise general tourism again and get people back to enjoying the amazing things that the Chippewa Valley has. So, any questions on that? Perfect. Thank you. You can always check out anything else on our website or on our Facebook, and it's the Chippewa Valley COVID-19 Task Force. Thank you.
Thank you, Benny, for sharing that. For those of you at home, think about those businesses that you either frequent regularly now or have in the past, and want to be sure that they are doing the things that they need to do to not only get up and going successfully again, but do it in a healthy way. Ask them what they're doing. Encourage them to look at the website and consider ways that they can do that in a safe way, and certainly connect them with the Chippewa Valley Economic Recovery Task Force work. It's a place that they can get questions answered and resources available to them. And again, COVID19eauclair.org is the website that you can send them to. If people have questions more broadly, again, we encourage them to call our call center number. That's 715-831-7425. That's a number you can call and talk to a real person Monday through Friday, and they can answer your questions about COVID-19 and next steps and resources that might be available to you. We encourage you to check the website out first, but that is also a possible resource. We will continue to do these web updates, the media casts on Mondays and Fridays, and on Wednesdays we'll do a little bit of a different format and make that available for you to learn about as well. If there are any questions, I can certainly answer those now. Yeah.
Please, how many cases, do you know how many cases you've had in the jail? I understand that they were brought in from outside, but how many?
Yeah, the question is related to how many total cases have we identified because of a test in the jail. I actually don't have that number with me right now. The question came forward just very recently, so we didn't pull that data yet, but we certainly have that available. Again, all of these individuals were tests that were done because someone happened to be in the jail. We know, like I've shared with you, that there's disease circulating in the community, and we certainly do have individuals that have been involved in the criminal justice system that are that there is spread happening. So some of those people do arrive at the jail, and when they have symptoms are being tested and found that way. I don't have a count right now, but we certainly can get that for everyone. Yes.
I'm curious if the health department is planning to use any new specific guidelines or regulations for county beaches this summer, in regards to social distancing, safety precautions, any specific regulations for beaches?
Yeah, so the question is, are there any plans for specific regulations related to beaches, given COVID-19, given safety precautions? Like all of our settings in Eau Claire, we've made the decision with our order to make sure that the same principles, the same public health principles be in place in every public setting, whether that's a beach or any other public place. There are some specific recommendations that are available at a state and federal level related to beaches, and we are providing those recommendations in addition to what's in our order. The requirements are those that exist in the order for now, so we are expecting that to continue, and as long as we see disease not progressing rapidly, we're hoping that that continues to be a place if people are following those basic principles of washing your hands, staying home when you're ill, and physical distancing, as well as the other items in there. That'll be a place we can enjoy this summer. Additional questions? Yes.
Speaking of congregate settings, can you talk about whether there have been any cases or concerns related to the homeless population? I know they're in hobs, so that they could have more space.
Mm-hmm.
Has that been enough, or have there been cases there as well?
So the question is related to the population that's experiencing homelessness right now in Eau Claire, and I think we all realize that we unfortunately have a sizable population that struggles with having regular and consistent housing, and the impact of COVID-19 on that population. A lot of work has been done to support our shelters that exist in Eau Claire, the family shelters as well as the Sojourner, which is our primary adult shelter. That shelter has been in a place where more distancing could occur and where there could be a bit more look at making sure people were safe and healthy, both staff and individuals there. And we have not seen an outbreak or any specific concerns in that congregate setting. It's an important one that we stay on top of and we support. There have been individuals who are experiencing homelessness not connected to the shelter who have had COVID-19, and we've had contacts and cases in that population. And it's certainly a challenge. So that's part of what we all need to care about in Eau Claire, is that we have people that not only have to deal with a challenging disease and the contacts and the potential challenges health-wise of that disease, but also who experience issues with not having regular and stable housing. So certainly something we've spent a lot of time on in this disease, and it's certainly something this community has to pay attention to long term. All right, thank you very much for your time today. We appreciate people paying attention to what's happening with COVID-19 in our community. We'll be back to update you more. Thank you.